As the ongoing industrial strike by members of the Joint Health Sector Union enters its fifth week, doctors at the Federal Medical Center Katsina have continued to put in their best to keep medical operations going at the facility. The Chief Medical Director says the engagement of locum staff has made it easier for the medical center to maintain efficient skeletal services to patients. Correspondent Awal Ibrahim has details.
The Federal Medical Center Katsina is one of the two tertiary hospitals in Katsina State, which cover virtually all the medical services in the state. But the ongoing industrial action embarked upon by members of the Joint Health Sector Union has significantly reduced the influx of patients that visit this facility for medical care. The Chief Medical Director assures that steps have been taken and adequate measures put in place for smooth operations in this hospital.
For most of us that are administrators now, our biggest fear is what's going to be the aftermath, the repercussion of the strike. When you come back, how is the doctor going to look at the other healthcare workers? How are the other healthcare workers going to look at doctors? What's going to be the relationship? And in as much as you don't have that teamwork, you don't work as a team, then you will not be able to provide the services that you're expected to provide.
On his part, Chairman of the Nigerian Medical Association Katsina State Chapter admitted that it has not been easy, but doctors are putting in all efforts to maintain operations in the facility. He described the ongoing industrial action by the Joint Health Sector Union as uncalled for, adding that there is nowhere in the world that doctors are on a parallel salary scale with other health workers.
Let me buttress this point by giving you some facts. Go around the world. Go to India, go to UK, go to the US, go to even our neighboring African countries here. There is nowhere a doctor earns the same salary as a hospital cleaner, with all due respect. It's a hospital cleaner, a ward attendant, a nurse, a lab scientist, or a pharmacist. There's nowhere in the world that happens. So why would parity be a demand from Johansson? It is unacceptable for government to tamper with that relativity. Relativity is something that we have sacrificed for over 25 years.
A visit to some of the units within the hospital showed doctors attending to patients, but they stated that it has not been an easy task.
Although it is very difficult for us with the situation, when you have to do the work of the nurses, the work of the cleaners, sometimes the work of the pharmacists, it's really difficult. But we know that it is part of our responsibility to do, because since these are things that we can actually work, although with some level of stressing ourselves.
The only thing is that we are doing some work which we are not supposed to do, like where in case of collecting money from the patient, then at the end of the day we now remit to the hospital management. We are like acting as cashiers, and also we are also acting as secretaries, because the result we are not supposed to type the result. When we finish, we write the report. In case of ultrasound scan, we write the result, then we give the secretary to type. But since they are not around, we are also doing that type of distant work.
Some of the patients expressed satisfaction with the level of services rendered, stressing that nothing seems to have changed despite the ongoing industrial action.
Any department I went, anywhere I met staffs there attending patients. So no place I went without personnel, without their doctors, or without their personnel attending patients. Where you went, you will see their personnel attending patients. I really appreciate it. I thought when I came here I will not be attended, but I am attended accordingly.
At the antenatal care department, Dr. Asma'u Abdul disclosed that they examined more than 70 patients a day. Awal Ibrahim, TVC News, Katsina.